Hello everyone, I'm Emma, and welcome to this comprehensive guide on the most prevalent methods of preventing pregnancy. Over the next 8 minutes, we'll explore various contraceptive options, discussing their effectiveness, pros, cons, and availability. Whether you're considering your options for the first time or looking to switch methods, this video will provide you with essential information to help inform your decision. Remember, choosing contraception is deeply personal, and what we'll discuss today should be followed up with a consultation with your healthcare provider. Let's begin with one of the most well-known methods, the combined pill. This daily tablet contains synthetic versions of estrogen and progesterone. Effectiveness: when taken perfectly, it's 99% effective, though with typical use, this drops to about 91%. Main pros: makes periods regular, lighter and less painful. Can improve acne and reduce PMS symptoms. Reduces risk of ovarian and womb cancer. Easily reversible. Fertility returns quickly after stopping. Main cons: must remember to take it every day at roughly the same time. Can cause side effects like headaches, mood changes and nausea. Small increased risk of blood clots, particularly for smokers over 35. Doesn't protect against STIs. Availability: in the UK it's free from GP surgeries and sexual health clinics. Many countries offer it over the counter or through online consultations. In the US, a prescription is required, with costs varying by insurance coverage. Moving on to barrier methods, with condoms being the most prevalent. Both male and female condoms are available, though male condoms are far more commonly used. Effectiveness: male condoms are 98% effective with perfect use, 82% with typical use. Female condoms are 95% effective with perfect use, 79% typically. Main pros: the only method that protects against both pregnancy and STIs, no hormonal side effects, readily available without prescription, can be used on demand. Main cons: can interrupt spontaneity, may reduce sensation for some people, can break or slip off if not used correctly. Some people have latex allergies, though non-latex options exist. Availability: widely available in supermarkets, pharmacies and online. Free from sexual health clinics in many countries. They're the most accessible form of contraception globally. Now let's discuss LARCs, long-acting reversible contraceptives. The copper IUD and hormonal IUS or coil are small T-shaped devices inserted into the womb. Effectiveness: over 99% effective, making them amongst the most reliable methods. Main pros: last 5-10 years depending on the type. Nothing to remember. Daily fertility returns immediately upon removal. The copper IUD is hormone-free. The hormonal IUS often makes periods lighter or stops them entirely. Main cons: insertion can be uncomfortable or painful. Possible side effects include irregular bleeding. Initially, small risk of expulsion or perforation. Doesn't protect against STIs. Requires a trained healthcare provider for insertion and removal. Availability: available through GP surgeries and sexual health clinics in the UK for free. In the US can be costly without insurance, but is covered by most plans. Requires a healthcare appointment for fitting. The implant is a small flexible rod inserted under the skin of your upper arm, releasing progesterone slowly over 3 years. Effectiveness: over 99% effective, one of the most reliable methods available. Main pros: lasts 3 years with no daily maintenance, can make periods lighter or stop them. Fertility returns quickly after removal, suitable for those who can't use estrogen. Main cons: can cause irregular bleeding, especially in the first year. Possible side effects include headaches, acne, mood changes. Requires minor procedure for insertion and removal. May be visible under the skin in very slim individuals. Availability: free from sexual health clinics and GPs in the UK. Covered by most insurance plans in the US. Requires trained healthcare provider for insertion. The contraceptive injection, often called Depo-Provera, is given every 12 to 13 weeks and provides reliable pregnancy protection. When used perfectly, it's over 99% effective, and with typical use, about 94% effective. One of the main benefits is that you only need to think about it once every 3 months. It can also stop your periods completely. The injection may help relieve symptoms of endometriosis for some people. On the downside, it can take up to a year for your fertility to return after stopping the injections. Weight gain is a common side effect. Long-term use can reduce bone density, so it's not always recommended for extended periods. Once the injection is given, it can't be reversed. You'll need to wait for it to wear off naturally. Irregular bleeding is common, especially at first. The injection is available at GP surgeries and sexual health clinics, but you'll need an appointment every 12 weeks for each dose. Natural family planning involves tracking your menstrual cycle to identify fertile days. This includes calendar methods, temperature tracking, and cervical mucus monitoring. Effectiveness: 76 to 88% effective with typical use, up to 99% with perfect use and proper training. Main pros: no side effects or hormones. Free. Once you've learned the method can also help when trying to conceive, increases body awareness. Main cons: requires daily commitment to tracking, need to abstain or use barrier methods during fertile days. Less reliable with irregular cycles. Takes several months to learn properly. Illness, stress and travel can affect accuracy. Availability: apps and thermometers are widely available. Many sexual health clinics offer free training. Proper instruction is crucial for effectiveness. If your regular method fails, emergency contraception can prevent pregnancy after unprotected sex. Types: the morning after pill, levonorgestrel or ulipristal acetate, and the copper IUD. Effectiveness: the copper IUD is most effective at 99%. Pills are 85 to 95% effective depending on how quickly they're taken. Main pros: can prevent pregnancy after contraceptive failure. Copper IUD provides ongoing contraception pills available without prescription in many countries. Main cons: less effective than regular contraception. Pills can cause nausea and irregular bleeding. Effectiveness decreases with time, not for regular use. Availability: available from pharmacies, GPs and sexual health clinics. Some types available over the counter, others need prescription. Finally, let's discuss permanent methods. Vasectomy for people with testes and tubal ligation for people with ovaries. Effectiveness: over 99% effective. Main pros: permanent solution. No ongoing maintenance, doesn't affect hormones. Main cons: should be considered irreversible, requires surgery, doesn't protect against STIs. Regret is possible if life circumstances change. Availability: available through NHS after counselling. Private options available. Waiting lists and age restrictions may apply. We've covered the main contraceptive methods available today. Remember, the best method is one you can use correctly and consistently. Consider your lifestyle, health conditions, and future plans when choosing. Always consult with a healthcare provider to discuss what's most suitable for you. Don't hesitate to try different methods if one isn't working. Your needs may change over time. Thank you for watching, and remember, informed choice is empowered choice.